Bismillahirrahmanirrahim. In the name of Allah, who is the most beneficent and the most merciful. Today we will discuss about the pathology. This book is the USMLE book. First of all, we will discuss about the cell injury. In case of the cell injury, cellular adaptations are the most important. These are all are the cellular adaptation. Hypertrophy, hyperplasia, atrophy, metaplasia, dysplasia. We will discuss the most important by the diagram. These are the normal cells. In case if increase in the number of the cells, this is the hyper, and the plasia mean number, increase in number. Hyper mean more, increase in the number of the cell. These are the 4 cell. In case these are the 6 cell, increase in the number of cell is called as the hyperplasia. But hypertrophy condition is the increase in the size of the cell. Cells does not change. These are the 4, but increase in the mainly protein increase, organelles present increase. But atrophy means decrease in the size of the cell because of the cell does not working. They wanna shrink down, and they can lead to then if wanna shrink down, it can lead to the both necrosis and the apoptosis. We will discuss later on the most important necrosis and the apoptosis. Other is these are the reversible changes, but irreversible changes can lead into the neoplasia. Neoplasia mean increase in the cancerous like cell. But I want to discuss with you the dysplasia and metaplasia. Dysplasia is the change in cell structure. Structure of the cell is changed. No more all are the different types of cells, and the structure is changed. But in case of the metaplasia, meta mean different, plasia mean increase, means change in the type of one epithelium to the other epithelium. This is mainly cuboidal epithelium, but in this case they wanna change into from cuboidal to the columnar. And both these, dysplasia and metaplasia, if it increase or a chronic form, they can lead to the neoplasia. This is the hypertrophy, means structural protein changes. I want to discuss with the increase in the structural protein and the organelles, and increase in the size of cell. Example is the cardiac hypertrophy, hypertrophy of the cardiac muscles. This is the mainly hypertrophy. Other is the mainly discussing with it is the hyperplasia. In case of the hyperplasia, mean increase in the number of the cells. This is the mainly controlled proliferation of the stem cells and differentiated cells, and they can lead to the increased number of the cell. Because if in case of the benign prostate hyperplasia, because prostate is the organ, and if testosterone increased, they mainly if increase in the testosterone, it can change into the dihydroxytestosterone, and dihydroxytestosterone increase in the size of the prostate gland. This condition is called as the benign prostate hyperplasia. Other is the excessive stimulation can lead to the endometrial hyperplasia. In case of the estrogen mainly increase in the endometrium size of the in size, and mainly increase the cell area, and mainly the number of the cell increases, the most important. But I will discuss with you the atrophy. Atrophy is the most important because size of the cells is decreased. Number one, if a person is not working, such as the after surgery, because after surgery, if there is a surgery of my hand, I cannot work properly, that can lead to the degeneration of the limbs area and degeneration of the muscles, and that can lead to the atrophy. Atrophy means decrease in the mass of the size, size of the cell decreases. This type is the mainly atrophy, decrease in the size of the cell. Other is the metaplasia. Metaplasia by the mean of the change in the structure form. This is the cuboidal change into the columnar type. We will discuss about the examples. Number one, this is the reprogramming cell death. I will discuss with you. The most important is the buried esophagus. What is the buried esophagus? Mainly you know better about that gastric acid. Lining of the gastric acid is made up of the columnar epithelium, and here this is the esophagus. If gastric content out of the gastric acid, if it moves into the esophagus, But esophagus is not specifically. These are the stratified squamous non-keratinized, and then it can change into the and replaced by the columnar epithelium for the acidic production. That's why it can change into the ciliated columnar epithelium. This is not here. This is the one cell type is the parrot esophagus. Other is the respiratory ciliated columnar epithelium is replaced by stratified squamous epithelium. Both are the reversible. I will be discussing with you the Barrett esophagus. In case of the Barrett esophagus, columnar epithelium in the esophagus change into the columnar. But in case of the respiratory system, there is a columnar epithelium change into the stratified squamous epithelium. This is the most important. Other is the dysplasia. Dysplasia is the most important. This is a disorder. I wanna discuss with you the most important is the disorder precancerous epithelial cell growth. There is a precancerous epithelial cell growth mainly increased in the normally nucleus ratio is increased out of the cytoplasm, but in case of the dysplasia nucleus ratio is increased in the ratio of the nucleus ratio is increased. Number one. Other is the thickness moderate dysplasia that can lead to the carcinoma. This is the neoplasia that can lead to neoplasia, and metaplasia can also lead to the dysplasia. The most important. I want to discuss you with the cell injury. There are two types of cell injury. Either it is reversible or the irreversible. This is the our mainly the cell type, normal cell type, and if there is an injury. In case of the ribosomal detachment, I want to be discussing you with the ribosomal detachment. This is mainly this is the endoplasmic reticulum, and the ribosomes are detached from the rough endoplasmic reticulum. These are the cellular mitochondrial swelling, increase in the size of the mitochondria. Other is the membrane bulging. This is the bulging area of the membrane. Here I want to see the bulging area of the membrane. And other is the nuclear chromatin clumping. In the case of the nucleus, the chromatin material is clumping. These four conditions are the most important changes into the reversible injury. But these four conditions I will be discuss you with the reversible is the ribosomal detachment, number one. Other is the plasma membrane changes, nuclear changes, rapid loss of myelin figure is the most important. Here this is not myelin figure, but these are the most important. Other I will be discussing with you the most important is the irreversible injury. In case of the irreversible injury, I want to be discuss with you the most important by the diagram. This is the irreversible injury. In case of the irreversible injury, if they cannot be if stimulus and more they can prone to the irreversible injury, in which plasma membrane damage, they leak out. And other is the mitochondrial permeability increases. Mitochondrial permeability is the most important because in next on we will discuss the mitochondria contains cytochrome C. Cytochrome C mainly involves in the apoptosis. If mitochondria is damaged, cytochrome is also in the cytoplasm, and that can lead to the death of the cell. This is called as the apoptosis or a necrosis. This is the most important. This is the nuclear degradation. These are the all points we will discuss in the cell injury, reversible and the irreversible cell injury. Other is the apoptosis and other is the necrosis. What is the apoptosis? Apoptosis means the programmed cell death. In this case, I will be discuss with you the programmed cell death. This is on the green side. This is the apoptosis. ATP dependent programmed cell death, and it has two pathways. Number one is the intrinsic pathway, other is the extrinsic pathway. Intrinsic pathway is also called as the mitochondrial pathway, and the extrinsic pathway is also called as the death receptor pathway. In case of the apoptosis, there is a mainly characterized by deeply eosinophil cytoplasm, and the basophilic nucleus pycnosis and the karyorrhexis. Pycnosis and the karyorrhexis is the most important about the apoptosis. And there is mainly apoptosis. I will be discuss the two pathways by the diagram. Then you will all discuss how it's happen in both. I will just discuss the diagram. In this case, if I want to be discuss with you is the two pathways. Number one is the intrinsic or the mitochondrial pathway, or the extrinsic or the death receptor pathway. Firstly, if there is a damage to the DNA, in case of the damage to the DNA by the radiation or ROS or the toxin, that mainly act on the p53 activation, that can lead to Bax and Bag. Bax and Bag is the BCL family. Bax and the Bag is the mainly, I will be discussing with you the Bax and Bag is the BCL family that mainly increase in the release of the cytochrome C from the, this is the chromosome, this is the mitochondria. If increase in the cytochrome C, there is increase in the initiation caspases. Initiation caspases mainly leads to the executioner caspase. Then there is a degradation of the cytoskeleton and the nuclear fragmentation, and here these are the cytoplasmic bulb, and there is a mainly phagocytose by the macrophages, and the death can occur. This pathway is known as the intrinsic pathway. Here DNA damage, Bax and Bag pathway. The most important is the BCL2 family. Other is the BCL2. This is the BCL2, which is the most important. I will be discuss with you the BCL2. This has the negative impact. The most important clinical is the, if there is increased expression of BCL2, no cytochrome C is released. If cytochrome C is not released, they cannot be phagocytosis or the apoptosis. If apoptosis does not occur, the death of the cell does not occur, they increase in the size. If they increase in the size, that can lead to the neoplasia. The most important MCQ is the, I want to discuss with you the, this is the, I will be discuss with you the most important is the this by diagram is the BCL2. If in expression of the BCL2 can lead to the neoplasia, the most important MCQs. Here we will discuss the intrinsic pathway. These are all I have discussed by the, and this is the BCL2 overexpression. This MCQs is most important. That can lead to decreased caspase activation and tumorigenesis, or leads to the neoplasia. The most important we have discussed. Other is the extrinsic or the death receptor pathway. In case of the extrinsic, this is the FASL legend, and these are the, this is the tumor necrosis factor alpha, and these are attached on the tumor necrosis factor, tissue necrosis factor, and they initiating caspases, then leads to the mainly all other the cytotoxic C cells. They mainly release of the enzyme B, and perforin mainly increase in the executioner caspases, that can lead to the atrophy. There is increase in the degradation of the cell by the macrophage system. These are the two pathways, intrinsic pathways and the extrinsic pathways. I will be discuss with you the intrinsic and extrinsic pathways are the most important by their mitochondrial pathway and the death receptor pathway. In case of the mitochondrial pathway, cytochrome C and BCL2 is the most important, you may recognize, but Bax and Bag increases, but BCL2 mainly inhibits it. This is mainly known as the apoptosis, because apoptosis is the mainly programmed cell death, in which it has two pathways and activated the caspases enzyme. These are the caspases enzyme, and mainly these are digestion by the macrophage system or the cytotoxic T cells. But in case of the necrosis, there is an exogenous injury. There is an injury to the cell and degradation and the protein denaturation. In case of the enzymatic degradation, I will be discuss you with you that this is the cell undergo enzymatic degradation and the protein denaturation. then can lead to the intracellular enzyme component leak and local inflammatory reaction occurs. Local inflammatory reaction does not occur in the apoptosis. That is a typical example. The most important are the types of the necrosis. There are 5 types of necrosis. Number 1 is the coagulative necrosis. Other is the liquefative necrosis. I will discuss the most important is the this is the coagulative, then the liquefative, caseous necrosis, fat, and the febrile necrosis. In case of the coagulative necrosis, coagulative means coagulation of the enzyme and the protein, both seen in the ischemia and infarct in most of the tissues, heart, kidney, in everything there is a coagulative necrosis. The most important MCQs is the exception is the brain. Most important is the exception on the brain. But in case of the liquefative necrosis, brain infarction. These are correlated. In case of the coagulative necrosis, ischemia or infarct. Ischemia means decrease oxygen supply to the organ. But this is a liquefative necrosis and there is a brain infarction. Here this is the exception. This is mainly due to the ischemia. Ischemia or infarction denatures the enzyme. Here enzymes are also denatured. Here this is a cell and enzyme are also denatured, then there is nothing to the cell happen. Enzyme are denatured, they cannot acting like, they cannot macrophages it, they cannot digesting it, then cell architecture is preserved. If I wanna be discussing it, if this is a cell and many things are the enzyme that are breaking down it, but if enzyme are not breaking down it, the structure of the cell is preserved. This is such an example, but structure of the cell is preserved. The most important MCQs is the cell structure preserved. Increased eosinophilia on the, I want to discuss with you the increased eosinophilia. This is the increased eosinophilia. Eosinophilia increased. This is the typical example of the coagulative necrosis. But I want to discuss you with the liquefative necrosis. In case of the liquefative necrosis, mainly affect the neutrophil release lysosomal enzyme. Here the macrophage is important and neutrophil and the cell debris are seen in the bacterial infection, because it is mainly the bacterial abscess formation and liquefaction and the neutrophil release lysosomal enzyme and the degrading the brain area. Here this is a typical example of the, this is a necrosis of the, I want to show that this area is the mainly liquefative necrosis of the brain. Other is the caseous necrosis. The most important is the caseous necrosis. In case of the caseous necrosis, mainly it occurs in TB patient, tuberculosis patient, systematic fungi, yani कि histoplasma encapsulatum and nocardia. In case of nocardiasis patient, these are the macrophages well of infectious organism. Mainly giant cells are present here. Most important in case of the caseous necrosis, mainly this is a prolonged term infection. Firstly neutrophil come, then in the chronic infection macrophages attracting. In case of the macrophages attraction, they produce the giant cell. In the microscopic, here these are not discussed, but in the microscopic giant cells are present, but these are present with the gross morphology. If we on a cross section by the gross morphology, cheese like appearance. Here this is a cheese like appearance. Here you want to see the cheese like appearance. Other will be discussed as the fat necrosis. Fat necrosis mainly enzymatic acute pancreatitis. In case of the acute pancreatitis, there is a release of the lipases enzyme. If increase of the lipases enzyme, breakdown of the fatty tissue. If breakdown the fatty tissue, they can convert into the fatty acid. And calcium is presenting here. If fatty acid combined with the calcium, then this process is the sponification or the chalk white appearance. The most important here, the sponification in the fat type necrosis is the sponification. I will be discussing you with you that this is a chalk like appearance. This is a mainly in the microscopic feature. the dark blue on the HE stain. Dark blue, this is the dark blue on the HE stain. But next wave we will discuss about the fibrinoid necrosis. In case of the fibrinoid necrosis, most of the deposition of the autoimmune, mainly antigen antibody complex attach with the blood vessels. I wanna just show the most important is the these are the mainly antibodies. These are the antibodies. This is the mainly antigen, and they are attached on the this is I wanna make the blood vessels here. This is a blood vessel. I wanna show there is a mainly complex of the antigen antibody complex attached with the blood vessel. The most important is the antigen antibody complex attached with the blood vessel. This type of hypersensitivity is called as the type 3 hypersensitivity, immune complex deposition. Here this is the on the pinkish side is a vessel wall contain eosinophilic layer. This is the eosinophilic layer. Outside it is the eosinophilic layer. Other is the gangrenous necrosis because of the distal extremities on the GI tract after chronic ischemia. It may be a dry and the wet. In case of the dry, it is a coagulative. It is a wet, it is called as a liquefative. This is the gangrenous, and on the distal part of the hand and the distal part of the phalanx. These are the phalanx. On the distal part of the phalanx, if there is a compromised blood supply and there is a necrosis here occurs here, this is called as the gangrenous necrosis. These are all types of necrosis are the most important: coagulative, liquefative, caseous, fat, fibrinoid, and the gangrenous necrosis that we all discuss. I wanna show you the most important other things: coagulative necrosis, liquefative, cases, fat necrosis, fibrinoid necrosis, and the gangrenous necrosis. I will be show the most important is ischemia. Ischemia is not so much important, but ischemia is important because of the most important is the inadequate blood supply to meet the demand. If there is a decreased blood supply by anything such as the atherosclerosis, if there is a atherosclerosis condition, blood flow is decreased, then condition of the ischemia can occur. This is not so much important, but the most important is the types of infarct. Types of infarction: if decreased blood supply, that can lead to the infarction of the tissue. Number one is the red infarct, other is the pale or a white infarct. Why which we will say about the red infarct? It mainly occurs in the venous occlusion. If there is a occlusion of the venous, blood flow moves back. If blood flow moves back, RBC is present, then RBCs are red color. That's why it is the red hemorrhage, red type. That's why it's called as the red infarct. In case of the pale infarct, mainly arterial blood supply is compromised, blood flow is not going, then there is necrosis here and there is a white like structure, and this is called as the pale infarct. Here this is the pale infarct and this is the red infarct due to occlusion of the vein system. Mainly the most important is the red infarct occur in the dual blood supply such as liver and the lung, but pale infarction is the most important. I will be discussing with you the wedge shaped appearance. Here in this case the pale infarct mainly occurs in the solid organ with single end stage blood supply. This is the mainly if there is a blood supply is compromised here, this is the wedge shape appearance. This is the kidney and the wedge shaped appearance on the pale or the white infarct, which is the most important. You will remember it. Other is the free radical injury. The most important is the free radical injury. Free radical injury may be due to any free radicals such as the number one is the free radicals are mainly by the radiations or the exposure can lead to the death of the cell. Mainly free radicals are eliminated by the scavenger receptor, such as you may know MCQs is the vitamin C, and other is the catalase, superoxide dismutase, and the glutathione peroxidase. The most important MCQs ever been is the free radical can be eliminated by the catalase enzyme, superoxide dismutase, glutathione peroxidase, and the vitamin A, C, and E. But the most important is that toxicity is important. Why oxygen is toxicity? Because oxygen, if we want to give the hyperperfusion of the oxygen, there can lead to the dysplasia of the bronchopulmonary dysplasia. Other is the reperfusion after the thromboembolic therapy, because we will discuss later on in case of the thromboembolic therapy, and if we're gonna reperfusion, but it can lead to the free radical allergy. We will discuss later on. Drug or the chemical toxicity, such type the acetaminophen, mainly overdose. Panadol, mainly acetaminophen, mainly consists of the COX inhibitor, and that can lead to the hepatotoxicity. And carbon tetrachloride mainly leads to the liver failure. But metal storage disease, such as the hemochromatosis, if there is a increased breakdown of the RBCs, there is a more and more accumulation of the iron. If you more and more accumulation of iron in the tissue, this is called as the hemochromatosis. And Wilson disease, mainly accumulation of the copper in the liver, is called as the Wilson disease, and these are the metal storage disease. Ionizing radiation are the most important, because radiation mainly toxicity, they can damage, if they occurs on the skin, they can damage on the skin area, and the hair loss, erythema, and the desquamulation, ulcer, and the necrosis. If in case of the hematopoietic, if in damage the bone area, that can lead to the myelosuppressions. Myelosuppression mean decrease in the RBCs, WBCs, platelet count, anything. These are mainly radiation, ionic radiation. These are not so much important, but I will be with you the most important is the type of calcification. There are two types of calcification. Number is the dystrophic calcification, other is the metastatic calcification. I will be with you the dystrophic and the metastatic. Dystrophic is the diseased tissue. If there is abnormal or diseased tissue, in case of the most important example is the calcific aortic stenosis. If there is a case of the aorta and stenosis here, and there is an accumulation of the calcium in the death area of the tissue, is called as the dystrophic calcification. D with the diseased tissue or the death receptor, tissue. Mainly associated condition is the TB and other granulomatous condition, and these are all are the such as the crust syndrome, and other are the atherosclerotic plaque. Most important can become calcified. Etiology second to injury or necrosis, but this is not so important. The most important I will be discuss with you is the metastatic calcification. Metastatic calcification, tissues are normal, but calcium level is increased in the blood. Calcium level is increased in the blood. What may be causes? Number one cause is due to hypercalcemia, increase in the calcium level in the blood by due to the hypervitamin doses. If vitamin D is increased, there is a increased calcium level in the blood. Other is the hyperparathyroidism. Hyperparathyroidism I will be discuss with you in the mainly I will red area. This is the hypercalcemia due to number one is the hypervitamin doses we have discussed. Other is the hyperparathyroidism. Hyperparathyroidism means increase in the level of PTH. If increase in the level of parathyroid hormone, that can lead to the increased in the calcium level in the blood. Other is the chronic kidney disease. Why CKD patient? Because chronic kidney disease, they want to compensate and increase the calcium phosphate product level, and it occurs mainly due to the normal tissues, metastatic calcification. The causes are the most important. I will be discuss with you the causes are the most important. but it may be occurs due to the pH favors calcium deposition. Why pH favors the calcium deposition? Because calcium are deposited if pH is increased. pH is increased if due to the tissue loose, gastric mucosa is loosed, and other is the interstitial tissue of the kidney of the lung or the lung. If predominantly interstitial tissue or the kidney or the tissue loose, if the gastric mucosa is decreased, then acidity is decreased, pH value is increased. Acidity decreased, pH value is increased. That is the most important. Other is the pigment deposition. This is the lipofuscin, and mainly this is I want to be discuss with you the lipofuscin. And here this is the lipofuscin and a yellow brown wear and tear pigment associated with the normal aging. This is the brown hair appearance, may be derived through the lipid peroxidation of the polyunsaturated. Mainly it is composed of two things. Number one is the lipid, other is the phospholipid complex with the protein. Number one, it mainly lipo mean lipid, fuscin mean fused with the protein. Lipid fused with protein. Lipid fused with protein, and there is mainly this is a chocolate-like appearance of the lipofuscin. But if I will be discussing the melanocyte accumulation. Melanocyte cells are accumulated, black pigment is increased. This is called as the melanoma. Pigment number, these are the lipofuscin. Other is the most important is the amyloidosis. Amyloidosis means abnormal aggregation of the protein and change into the beta plated sheet. This is the normal protein. If this is a normal protein, if there is aggregation, then can lead to the beta plated linear sheet. If it is a beta plated linear sheet, that can convert to the insoluble fibrils. If there is insoluble fibrils, I want to discuss with you the types most important. Number one is the primary amyloidosis. This is the AL from the Ig light chains. This is the amyloid light, AL amyloid light, because there is a more and more light chains are deposited. There are if antibody consists of two things, if there is a light chain and the heavy chain, but in this case there are more of the light chains are deposited. Other is the secondary amyloidosis. Secondary amyloidosis may the serum amyloid associated protein is increased. Description is not so much important, but manifestation is the most important. Increased in the restrictive cardiac myopathy. Other is the serum amyloid associated protein is increased in case of the seen in the chronic inflammatory conditions such as the IBD, inflammatory bowel disease, rheumatoid arthritis, familial, that we all discussed. Other is the dialysis related amyloidosis. The dialysis mainly if patient is on the dialysis, if the kidney is not working, increase in the beta 2 microglobulin. Increase in the beta microglobulin. This is the protein chain which is the misfolded. That's why this is called as the dialysis related amyloidosis. Other may be the localized in case of Alzheimer's disease, beta amyloid protein, and because beta amyloid proteins are, I want to be discussed with you the amyloid precursor protein. Amyloid precursor protein, if there is a proteolysis, I will discuss the most important is this is the amyloid precursor protein. If in case of the amyloid precursor protein there is a proteolysis, if there is a proteolysis, there is a beta amyloid protein. All are the mainly these are the hereditary, familial, amyloid, cardiopathy, other, these are not so much important, but amyloidosis and are the most important by the deposition of the beta plated linear sheet. This is the mainly beta plated sheet, and this is the apple green color. This is the apple green color. That we all discuss about the cell injury in the USMLE board. Next inshallah we will discuss about the inflammation. Thank you so much. Jazakallah. Allah Hafiz. Please like and subscribe our channel Medicose Fever, and remember us in your prayers. Allah Hafiz.